Question 1. Topic: Learning theory. Cognitive learning mechanisms. A trainer is working with a dog that has learned to retrieve a specific toy upon hearing the command fetch. However, when the trainer changes the toy, the dog becomes confused and fails to retrieve the new object. Which cognitive learning concept best explains the dog's confusion? A. Stimulus generalization. B. Stimulus discrimination. C. Habituation. D. Latent learning. Answer: B. Stimulus discrimination. Explanation: stimulus generalization occurs when a response is extended to stimuli similar to the original. If the dog generalized the command to any toy, it would have retrieved the new toy. Stimulus discrimination refers to the ability to distinguish between different stimuli. The dog has learned to associate the command fetch specifically with the original toy, leading to confusion when the stimulus changes. Habituation involves decreasing responsiveness to a repeated stimulus which is unrelated to this context. Latent learning is learning that occurs without obvious reinforcement but isn't demonstrated until needed, which also does not fit this scenario. Understanding stimulus discrimination is crucial in ensuring that commands can generalize to new contexts effectively. Question 2. Scenario-based. Topic: Behavioral assessment and diagnostics. Dr. Thompson is called to evaluate Max, a 2-year-old Labrador retriever, for aggression issues. According to the owner, Max growls and snaps whenever approached while eating. During the consultation, Dr. Thompson observes that Max stiffens his body, lowers his head, and growls when the owner attempts to remove his food bowl. What is the most appropriate first step for Thompson in addressing this behavior? A. Immediately implement counter-conditioning techniques during the consultation. B. Conduct a thorough behavioral history, including medical evaluation, before proceeding. C. Advise the owner to use punishment to deter the behavior. D. Recommend reharming the dog to avoid potential safety risks. Answer: B. Conduct a thorough behavioral history, including medical evaluation, before proceeding. Explanation: B. A detailed behavioral history is critical to differentiate behavioral issues from medical conditions, e.g. pain or gastrointestinal problems. Gathering contextual information, e.g. triggers, duration, and frequency of aggression, is essential for developing an effective intervention plan. A. Counter-conditioning techniques should only be implemented after a diagnosis is made and safety protocols are in place. C. Punishment often exacerbates aggression by increasing fear and anxiety, making it an unethical and counterproductive approach. D. Reharming is a last resort and inappropriate as an initial recommendation without exploring behavioral and medical solutions. Behavior consultants must prioritize accurate diagnostics, evidence-based interventions to ensure the safety and welfare of both the dog and the owner. Question 3. Topic: Behavioral disorders. Noise sensitivities. Which of the following best describes the scientifically supported approach to managing noise sensitivities in dogs? A. Gradual desensitization combined with counter-conditioning. B. Immediate use of punishment to deter anxious behaviors. C. Confinement in a crate without additional intervention. D. Ignoring the behavior entirely to avoid reinforcement. Answer: A. Gradual desensitization combined with counter-conditioning. Explanation: A gradual desensitization involves exposing the dog to low-intensity versions of the feared noise while ensuring the animal remains calm, gradually increasing the intensity over time. Counter-conditioning pairs the noise with a positive experience, e.g. treats, helping the dog develop a new positive association. B. Punishment can increase fear and anxiety, the problem, and violating humane training principles. C. While confinement may provide temporary relief, it does not address the underlying fear and may lead to additional stress. D. Ignoring anxiety does not help the dog learn coping mechanisms and can leave the fear unaddressed. This approach aligns with the American Veterinary Society of Animal Behavior's guidelines on humane behavior modification techniques. Question 4. Topic: Foundations of animal behavior. Neurobiology of behavior. Which brain structure is most associated with processing fear and emotional responses in animals, influencing their behavior during stressful events? A. Hippocampus. B. Amygdala. C. Thalamus. D. Cerebellum. Answer: B. Amygdala. Explanation: Amygdala. This structure plays a critical role in processing emotions, especially fear, and is central to the fight-or-flight response. It helps animals evaluate threats and adjust behavior accordingly. Hippocampus, primarily involved in memory and spatial navigation, though it works with the amygdala during emotional events. Thalamus relays sensory information to appropriate brain areas, but does not specialize. Emotional processing. Cerebellum. Coordinates, movement, and balance, not directly related to fear responses. This understanding is foundational for behavior consultants to assess fear-based behaviors accurately. Question 5. Topic: Behavior modification techniques. Systematic desensitization. A cat exhibits fear when hearing the vacuum cleaner. How should a behavior consultant apply systematic desensitization to address this issue? A. Expose the cat to the vacuum cleaner at full intensity to promote rapid adaptation. B. Gradually increase exposure intensity, starting with the vacuum cleaner turned off while ensuring the cat remains calm. C. Use food rewards only when the vacuum cleaner is running at full power. D. Punish the cat for fearful reactions to discourage the behavior. Answer: B. Gradually increase exposure intensity, starting with the vacuum cleaner turned off while ensuring the cat remains calm. Explanation: B. Systematic desensitization involves exposing the cat to a feared stimulus at a low intensity and gradually increasing the exposure, ensuring the cat stays below its fear threshold. For example, starting with the vacuum cleaner often at a distance helps the cat acclimate without stress. A. Full intensity exposure risks overwhelming the cat, leading to worsening fear sensitization. C. Rewards are beneficial but should be paired with calm behavior at manageable stimulus levels. D. Punishment is counterproductive and may increase fear or anxiety. This method aligns with ethical, evidence-based practices for behavior modification. Question 6. Scenario-based. Topic: Behavior and legal considerations. Dangerous animal assessments. MS. Carter owns a dog, Bella, that bit a neighbor's child. The child required medical attention and the neighbor is pursuing legal action. Upon consultation, MS. Carter reports that Bella had been teased by neighborhood children before the incident. How should the behavior consultant proceed with assessing Bella's behavior? A. Immediately label Bella as dangerous dog based on the incident. B. Conduct thorough behavioral history and environmental assessment to evaluate the context of the bite incident. C. Advise MS. Carter to euthanize Bella to avoid future incidents. D. Suggest isolating Bella indefinitely to prevent additional bites. Answer: B. Conduct a thorough behavioral history and environmental assessment to evaluate the context of the bite incident. Explanation: B. A full behavioral history is essential to understand the triggers, environment, and sequence of events leading to the bite. Identifying stressors like teasing helps design appropriate interventions. Labeling the dog without a proper evaluation is unethical and may not reflect the full context. C. Euthanasia is an extreme measure that should only be considered after exploring all alternatives. D. Isolation may exacerbate fear and aggression, increasing risks. Behavior consultants must adhere to local laws and professional ethics, such as those outlined by the American Veterinary Society of Animal Behavior and state dangerous regulations. Question 7. Topic: Normal behavior across species. Feline behavior. Which of the following best describes why a cat engages in an eating behavior on soft surfaces? A. It is a predatory behavior signaling the cat is about to hunt. B. It is a territorial marking behavior using scent glands on the paws. C. It is a comfort-seeking behavior stemming from kin. D. It is a sign of stress and anxiety in the environment. Answer: C. It is a comfort-seeking behavior stemming from kittenhood. Explanation: C. Kneading is often associated with kittens nursing from their mothers and is retained as a comforting behavior into adulthood. A. Kneading is unrelated to predatory behavior, which involves stalking and pouncing. B. While cats do have scent glands in their paws, kneading is not primarily a marking behavior. D. Stress behaviors in cats typically include hiding, over-grooming, or vocalizing rather than kneading. Understanding normal feline behaviors like kneading is crucial for distinguishing them from behavioral issues. Question 8. Topic: Pharmacology and behavior management. SRIS. Which of the following scenarios would most likely benefit from the use of an SRI in conjunction with behavior modification? A. A dog that barks excessively when left alone, showing signs of separation anxiety. B. A horse that bucks during training due to improper saddle fit. C. A cat that scratches furniture due to lack of appropriate scratching posts. D. A dog that chases its tail occasionally without distress. Answer: A. A dog that barks excessively when left alone, showing signs of separation anxiety. Explanation: ASRIS selective serotonin reuptake inhibitors are effective for managing anxiety disorders, including separation anxiety, by increasing serotonin levels to regulate mood. B. Behavioral issues due to physical discomfort G. Saddle fit, require addressing the root cause, not medication. C. Providing appropriate resolves this issue without pharmacological intervention. D. Occasional tail chasing is unlikely to warrant medication unless it becomes compulsive. Estrus must be prescribed by veterinarians and combined with behavior modification for optimal outcomes. Question 9. Topic: Behavioral disorders. Phobias and fear responses. A dog becomes extremely distressed during thunderstorms, panting, pacing, and hiding. What is the best initial step to address this phobia? A. Use punishment to stop the distressed behaviors. B. Provide a safe, quiet space and begin a desensitization and counter-conditioning program. C. Expose the dog to loud thunder recordings at full volume immediately. D. Ignore the dog's fear to avoid reinforcing the behavior. Answer: B. Provide a safe, quiet space and begin a desensitization and counter-conditioning program. Explanation: B. Creating a safe space reduces the dog's immediate stress. Desensitization, gradually exposing the dog to recorded thunder sounds at low intensity, and counter-conditioning, pairing with positive experiences, can help alleviate the phobia. A. Punishment is unethical and increases anxiety. C. Sudden full volume exposure risk sensitization, worsening the fear. D. Fear behaviors are not reinforced by attention. Ignoring them fails to address the phobia. Ethical and evidence-based methods prioritize the animal's well-being and gradual adjustment. Question 10. Topic: Behavior consulting practice management. Record keeping and documentation. Why is thorough documentation critical for behavior consultants when managing client cases? A. To share private client information with other pet professionals without consent. B. To maintain accurate records for legal, ethical, and professional accountability. C. To avoid communicating directly with clients about their pet's progress. D. To store data solely for personal research purposes. Answer: B. To maintain accurate records for legal, ethical, and professional accountability. Explanation: B. Detailed documentation is vital for tracking progress, informing treatment decisions, and complying with legal and professional standards. It protects both the consultant and client in case of disputes or liability issues. A. Sharing information requires client consent and adherence to privacy laws. C. Communication with clients is a core aspect of behavior consulting, not an alternative to documentation. D. Records should serve professional purposes and client support, not personal research without consent. This aligns with best practices outlined by professional organizations like the American Veterinary Society of Animal Behavior. Question 11. Topic: Learning theory. Positive reinforcement. A dog trainer is teaching a dog to sit on command. Each time the dog sits, the trainer immediately rewards the dog with a treat. What is this process an example of? A. Positive reinforcement. B. Negative reinforcement. C. Positive punishment. D. Negative punishment. Answer: A. Positive reinforcement. Explanation: A. Positive reinforcement involves adding a pleasant stimulus, a treat, to increase the likelihood of the desired behavior sitting. B. Negative reinforcement removes an unpleasant stimulus to increase behavior, which does not apply here. C. Positive punishment involves adding an unpleasant stimulus to reduce a behavior. D. Negative punishment removes a pleasant stimulus to decrease behavior. Method encourages learning through rewards, a key component of ethical behavior modification. Question 12. Topic: Ethics in behavior consulting. Confidentiality. A client shares sensitive information about their pet's history, including previous mistreatment, during consultation. How should behavior consultant handle this information? A. Share the information freely with other professionals without client consent. B. Keep the information confidential unless required by law to disclose it. C. Use the information as an example in public seminar without identifying the client. D. Ignore the information as it is irrelevant to the pet's current behavior. Answer: B. Keep the information confidential unless required by law to disclose it. Explanation: B. Confidentiality is a cornerstone of ethical practice. Consultants must respect client privacy unless disclosure is legally mandated, e.g. abuse cases. A. Sharing without consent violates professional ethics and privacy standards. C. Using case details for educational purposes requires anonymization and client consent. D. Understanding the pet's history is essential for designing effective behavior modification plans. This aligns with ethical guidelines established by professional organizations. Question 13. Topic: Stress and coping in animals. What is a common physiological sign of stress? in dogs during a stressful event? A. Tail wagging. B. Increased salivation and panting. C. Sleeping more than usual. D. Reduced appetite. Answer: B. Increased salivation and panting. Explanation: B. Stress triggers the autonomic nervous system, leading to increased panting, salivation, and other fight or flight responses. A. Tail wagging can indicate various emotional states and is not a reliable stress indicator. C. Sleeping more is a potential sign of depression, not immediate stress. D. Reduced appetite may occur after prolonged stress rather than during acute events. Recognizing stress signals helps consultants address the root causes effectively. Question 14, scenario-based. Topic: client communication and education. A client insists that their dog's aggression towards other dogs is due to the breed and cannot be changed. How should the behavior consultant address this belief? A. Agree with the client and recommend rehoming the dog. B. Explain that behavior is influenced by multiple factors, including genetics, environment, and learning, and outline a plan to manage and modify the aggression. C. Suggest avoiding other dogs altogether without attempting to modify the behavior. D. Dismiss the client's belief without addressing their concerns. Answer: B. Explain that behavior is influenced by multiple factors, including genetics, environment, and learning, and outline a plan to manage and modify the aggression. Explanation: B. Providing education on the multifactorial nature of behavior helps clients understand that aggression can often be managed or reduced through training and behavior modification. A. Rehoming should be a last resort and only after exploring other solutions. C. Avoidance alone does not address the underlying issues and limits the dog's quality of life. D. Ignoring the client's belief risks losing trust and cooperation. Effective communication and education are vital for successful outcomes. Question 15, topic: environmental enrichment. Cats, which of the following is the most effective environmental enrichment strategy for indoor cats? A. Allowing them to roam outdoors unsupervised. B. Providing scratching posts, climbing structures, and interactive toys. C. Feeding them only dry kibble from a bowl. D. Limiting interaction with people to reduce stress. Answer: B. Providing scratching posts, climbing structures, and interactive toys. Explanation: B. Enrichment stimulates mental and physical activities, satisfying natural feline behaviors like climbing, scratching, and hunting. A. Outdoor roaming poses risks such as predators, traffic, and disease. C. Using food puzzles or hunting games instead of standard feeding can enhance enrichment. D. Cats benefit from regular positive interactions with their owners and other animals if introduced appropriately. Enrichment improves overall welfare and reduces behavior problems in indoor cats. Question 16, topic: operant conditioning. Behavior extinction. A dog has learned to bark for attention. The owner decides to ignore the barking consistently. What behavioral process is the owner using to reduce barking? A. Positive punishment. B. Negative reinforcement. C. Extinction. D. Counter conditioning. Answer: C. Extinction. Explanation: C. Extinction involves removing the reinforcement, in this case attention, that maintains a behavior, causing it to decrease over time. A. Positive punishment would involve adding an aversive stimulus to reduce behavior. B. Negative reinforcement involves removing an unpleasant stimulus to increase a behavior, which is not applicable here. D. Counter conditioning focuses on teaching an alternative response rather than ignoring the behavior. Consistency in ignoring the barking is essential for extinction to work effectively. Question 17, topic: dog body language. Signs of fear. Which of the following is a common sign of fear in dogs? A. Wagging tail held high. B. Ears pinned back, tail tucked, and avoidance of eye contact. C. Relaxed posture with open mouth. D. Barking while lunging forward. Answer: B. Ears pinned back, tail tucked, and avoidance of eye contact. Explanation: B. These are classic indicators of fear or submission in dogs. A tail held high often signifies confidence or alertness, not fear. C. A relaxed posture is associated with comfort, not fear. D. Barking and lunging could indicate fear, aggression, or territorial behavior, but not fear alone. Recognizing fear signals helps owners and consultants respond appropriately to reduce stress. Question 18, topic: behavioral thresholds. Trigger stacking. A dog that is usually calm becomes reactive after encountering multiple stresses in a short period. E.g. loud noises, unfamiliar visitors, and restraint. What is this phenomenon called? A. Desensitization. B. Trigger stacking. C. Flooding. D. Habituation. Answer: B. Trigger stacking. Explanation. B. Trigger stacking occurs when multiple stresses accumulate, pushing an animal beyond its threshold for coping. A desensitization involves gradual exposure to reduce sensitivity to triggers. C. Flooding refers to overwhelming exposure to a stimulus, often leading to increased fear. D. Habituation is the process of becoming less responsive to a repeated stimulus over time. Understanding trigger stacking helps consultants design more effective management and training plans. Question 19, scenario-based. Topic: client compliance. A client reports inconsistent progress with their dog's training plan. Upon further discussion, you discover the client isn't practicing regularly due to busy schedule. How should you address this issue? A. Express frustration with the client for not following the plan. B. Modify the training plan to incorporate shorter, more manageable sessions. C. Suggest the client hire a professional trainer to take over completely. D. Insist that the client prioritize the training above their other commitments. Answer. B. Modify the training plan to incorporate shorter, more manageable sessions. Explanation. B. Tailoring the plan to fit the client's lifestyle increases the likelihood of compliance and success. A. Expressing frustration could damage the client-consultant relationship. C. Hiring trainer may not address the underlying compliance issue and can increase costs unnecessarily. D. While training is important, flexibility is essential to ensure the plan is sustainable for the client. Question 20. Topic: aggression types. Redirected aggression. What is redirected aggression in dogs? A. Aggression directed at an unrelated target due to frustration or arousal. B. The aggression shown towards a familiar person during play. C. Aggression that occurs only when guarding resources. D. Aggression displayed due to fear of unfamiliar objects. Answer. A. Aggression directed at an unrelated target due to frustration or arousal. Explanation. A. Redirected aggression happens when an animal cannot reach the intended target of its frustration and instead attacks a nearby individual or object. B. Play-related aggression is a different type of behavior. C. Resource guarding involves defending valuable items, not redirection. D. Fear aggression is context-specific and not related. Redirection. Understanding the cause of redirected aggression is essential for developing effective intervention strategies. Question 20 on topic: socialization periods in puppies. During the critical socialization period, what is the most effective way to help a puppy develop positive behaviors toward new experiences? A. Expose the puppy to all possible scenarios regardless of stress level. B. Allow the puppy to explore new situations at its own pace with positive reinforcement for calm behavior. C. Limit the puppy's exposure to new experiences until it is fully vaccinated. D. Use punishment to discourage fear responses in new situations. Answer. B. Allow the puppy to explore new situations at its own pace with positive reinforcement for calm behavior. Explanation. B. Gradual exposure paired with positive reinforcement helps build confidence and prevent fear-based behaviors. A. Overwhelming a puppy can lead to stress and fear, which may result in long-term behavioral issues. C. While vaccinations are important, controlled exposure in safe environments is critical during the socialization period. 3-4 weeks. D. Punishment can exacerbate fear and anxiety, worsening the puppy's response to new stimuli. Proper socialization lays the foundation for well-adjusted adult dog. Question 22. Topic: compulsive behaviors. Environmental enrichment. A cat displays compulsive overgrooming resulting in bald patches. What is the most appropriate first step in addressing this behavior? A. Immediately prescribe an anti-anxiety medication. B. Provide environmental enrichment and increase opportunities for play. C. Punish the cat whenever overgrooming is observed. D. Ignore the behavior as it will likely resolve on its own. Answer. B. Provide environmental enrichment and increase opportunities for play. Explanation. B. Compulsive behaviors in cats are often triggered or exacerbated by environmental stress or boredom. Enrichment and play reduce stress and redirect the cat's focus. A. Medication may be necessary in severe cases, but is not the first step. C. Punishment can increase stress and worsen compulsive behaviors. D. Ignoring the behavior without addressing its underlying causes is ineffective and may allow it to escalate. Behavior consultants must evaluate environmental factors contributing to compulsive behaviors before recommending further intervention. Question 23. Scenario-based. Topic: fear aggression in dogs, MS. Carter's dog, Max, growls and barks aggressively whenever visitors enter her home. She explains that Max was fine as puppy but has become increasingly reactive over the past year. What should MS Carter do to manage Max's behavior? A. Confine Max to another room whenever visitors are present and avoid addressing the issue further. B. Punish Max whenever he growls to teach him that aggression is unacceptable. C. Work on desensitizing and counter-conditioning Max by associating visitors with high-value treats. D. Allow visitors to approach Max directly and reassure him with petting until he calms down. Answer: C. Work on desensitizing and counter-conditioning Max by associating visitors with high-value treats. Explanation: C. Desensitization and counter-conditioning help change Max's emotional response to visitors, reducing fear and aggression. A. Simply confining Max without addressing his fear does not solve the underlying issue. B. Punishment for growling can suppress warnings and escalate aggression without addressing the root cause. D. Allowing visitors to approach Max directly may increase his fear and reactive behavior. Behavior consultants should use gradual, positive approaches to help fearful dogs build confidence. Question 24. Topic: Separation anxiety. Behavioral modification. A dog with separation anxiety chews furniture and howls when left alone. What is the best initial strategy to address this issue? A. Leave the dog alone for longer periods to force it to adjust. B. Use systematic desensitization to gradually increase the time the dog spends alone. C. Punish the dog upon returning home to discourage the behavior. D. Provide a large meal before leaving to keep the dog occupied. Answer: B. Use systematic desensitization to gradually increase the time the dog spends alone. Explanation: B. Gradual exposure to being alone helps the dog adjust without overwhelming it. This can be paired with positive reinforcement for calm behavior. A. Forcing long absences can worsen anxiety. C. Punishment upon returning home is ineffective and may confuse the dog. D. Feeding the dog before leaving does not directly address the emotional distress caused by separation. Separation anxiety requires structured interventions tailored to the dog's specific needs. Question 25. Topic: Counter-conditioning. Fear of veterinary visits. A cat exhibits extreme fear during veterinary visits, hissing and hiding in its carrier. What strategy would help reduce the cat's fear over time? A. Avoid veterinary visits unless absolutely necessary. B. Gradually acclimate the cat to the carrier and the clinic environment with positive reinforcement. C. Restrain the cat more securely to prevent hissing. D. Use punishment to discourage hissing behavior. Answer: B. Gradually acclimate the cat to the carrier and the clinic environment with positive reinforcement. Explanation: B. Counter-conditioning involves associating the carrier and clinic with positive experiences, reducing fear over time. A. Avoidance does not address the underlying fear and can lead to health risks if care is delayed. C. Increased restraint may increase fear and stress. D. Punishment can escalate fear and damage trust. Using a gradual, patient approach is key to helping fearful cats tolerate veterinary visits. Question 26. Topic: Resource guarding in dogs. A client reports that their dog growls and snaps when someone approaches its food bowl. What is the best initial step to address this behavior? A. Remove the food bowl entirely and feed the dog only by hand. B. Punish the dog whenever it growls to stop the behavior. C. Use desensitization by gradually approaching the food bowl while tossing high-value treats. D. Allow the dog to eat in peace without ever approaching the food bowl. Answer: C. Use desensitization by gradually approaching the food bowl while tossing high-value treats. Explanation: C. Desensitization reduces the dog's fear or anxiety by creating positive associations with people near its food. Feeding by hand is impractical long-term and does not address the root cause of guarding. B. Punishing growling can suppress warnings and increase the risk of sudden aggression. D. Avoiding the behavior entirely doesn't resolve the problem and could lead to escalation in other contexts. The goal is to teach the dog that humans near its resources are not threat. Question 27. Topic: Behavior modification. Fearful cat. A cat hides under the bed for hours whenever visitors come over. What is the most effective approach to help the cat feel more comfortable? A. Force the cat out from under the bed to interact with visitors. B. Use calming pheromone sprays and create a safe enclosed space for the cat. C. Ignore the behavior as the cat will eventually adjust on its own. D. Have visitors offer treats directly to the cat to lure it out of hiding. Answer: B. Use calming pheromone sprays and create a safe enclosed space for the cat. Explanation: B. Providing a safe space and using calming aids can help reduce the cat's stress and gradually increase its comfort. 8. Forcing interaction can worsen fear and erode trust. C. Ignoring the behavior may allow fear to persist without resolution. D. Offering treats may work in some cases, but can also backfire if the cat feels cornered. Patient and stress-free approach is essential for helping fearful cats. Question 28. Topic: Redirected aggression in cats. A cat becomes aggressive toward its owner after seeing another cat outside through the window. What is the best way to manage this behavior? A. Block the outside view and redirect the cat's focus to toy or treat. B. Punish the cat immediately to discourage aggression. C. Allow the cat to vent its aggression until it calms down. D. Ignore the behavior as it will eventually subside on its own. Answer 8. Block the outside view and redirect the cat's focus to toy or treat. Explanation: A. Removing the trigger, the outside cat, and redirecting the cat's energy helps prevent escalation and reduces stress. B. Punishment can worsen aggression and fear. C. Allowing the aggression to continue poses safety risks to the owner. D. Ignoring redirected aggression does not address its underlying cause. Behavioral intervention and environmental management. Key to preventing redirected aggression. Question 29. Scenario-based. Topic: Fear-free handling in veterinary settings. A dog resists being handled during a veterinary exam, growling and attempting to bite. The clinic has labeled the dog as aggressive. Or what should the veterinary team do to improve the handling experience? A. Use muzzle and firmly restrain the dog to complete the exam as quickly as possible. B. Sedate the dog immediately for all future visits. C. Use fear-free techniques, such as low-stress handling and positive reinforcement, to build trust over time. D. Avoid scheduling appointments for the dog unless absolutely necessary. Answer: C. Use fear-free techniques, such as low-stress handling and positive reinforcement, to build trust over time. Explanation: C. Fear-free techniques prioritize the dog's emotional well-being, making future exams less stressful. A. Firm restraint may escalate fear and aggression. B. Sedation may be necessary in extreme cases, but should not be the default solution. D. Avoiding appointments delays necessary care and does not address the dog's fear. Fear-free handling reduces stress and promotes positive experience for both pets and veterinary teams. Question 30. Topic: Click training basics. Which of the following best describes the primary purpose of a clicker in dog training? A. It serves as a reward for the dog's behavior. B. It acts as punishment for incorrect responses. C. It marks the exact moment the desired behavior occurs, followed by reward. D. It distracts the dog to stop unwanted behaviors. Answer: C. It marks the exact moment the desired behavior occurs, followed by a reward. Explanation: C. The clicker is a conditioned reinforcer, signaling to the dog that a reward is coming for a specific behavior. A. The click itself is not the reward, but rather a marker. B. Clickers are never used for punishment. D. Clickers are not meant to distract, but to communicate precise timing in training. Clicker training relies on clarity and consistency to teach new behaviors effectively.